is one unlucky tourist's last stop.
Sir?
And the key evidence,
A pair of bungee smugglers,
proves quite revealing. New Death in Paradise, Saturday 7:30.
Whenever you want, wherever you are, know the story with ABC News, the most trusted news source. Get breaking updates with live notifications and access the latest news and information.
Give yourself the best chance you can.
Go to news.abc.net.au or download the ABC News app.
Employment preservation, a record rescue package to keep the nation's workers on the job. Results in minutes. The new COVID-19 rapid testing tool approved for rollout.
And coming up on The Business, the $130 billion wage lifeline. We ask big business and the Casual Worker Union if it's enough and can it protect jobs?
This is ABC Late News. Hello, I'm James McHale. Scott Morrison is forging into uncharted territory, launching a record package to try to preserve the jobs of up to 6 million workers. It is by far the biggest single spending program ever committed, and it'll be spent in just 6 months. Here's political editor Andrew Probyn.
Australia's seen nothing like it.
Now is the time to dig deep. Governments making decisions like they never have before.
An astonishing third economic rescue package, upping the defences against a crisis that confounds like no other before.
We are committing $130 billion over the next 6 months to support the jobs and livelihoods of what we anticipate of being almost 6 million Australians.
That's $5 billion a week to be spent tackling a jobs killer, one that's already seen hundreds of thousands of Australians join Centrelink queues. The $1,500 a fortnight JobKeeper Allowance will be payable to full-time, part-time and casuals who've been on the books for more than a year. That's up to 6 million Australians, or nearly half the working population. Small and medium-sized businesses who've lost more than 30% of turnover will be eligible. For businesses with turnovers of $1 billion or more, they'll be eligible if their turnover has dropped by 50% or more. It's backdated to the 1st of March, meaning many of those made redundant in the past few weeks might get the payment.
So if you're an employer who's been forced as a result of the downturn following the coronavirus to retrench workers, you'll put them back on your books and you'll receive this $1,500 payment.
Employees won't be going to Centrelink. They won't be engaging with the social security system. They'll be engaging directly with their employer, and their employer will be making the payments.
For this struggling golf club in Brisbane, it hits the spot.
Oh, that would help us big time because we'd be enabled to keep our full-time staff.
The club's lost 80% of business and had to lay off 3 full-time workers and all the casuals.
And I'm on edge if I'll have an income and places to go afterwards, but that should keep everyone rolling and happy.
In throwing a gobsmacking amount of money at the coronavirus crisis, the government's so-called hibernation strategy is taking shape. At enormous cost, it wants the Australian workforce to spring back to life as soon as the virus threat lifts, whenever that is. The stakes couldn't be higher. The Prime Minister grimly predicts this crisis will bankrupt some nations and cause others to collapse altogether. He's determined to make sure Australia isn't one of them. Andrew Probyn, ABC News, Canberra.
18 people have died from the virus in Australia. 17 of them were over 70 and the other a man in his 60s. And the battle to slow the spread of COVID-19 will see more changes to outdoor life, and they'll be enforceable by police.
Pitt Street Mall at lunchtime, a scattering of people, but far from the typical CBD rush. Playgrounds are cordoned off, park equipment too. New South Wales seems to be getting the message.
If you need to work, of course you need to leave the house. If you need to buy essentials, of course you need to leave the house or get medical attention, or if you're doing your exercise. They're acceptable reasons to leave the house, but beyond that, nobody should be really leaving the house.
And if you do, it can only be with one other person. unless they're family or housemates. The restriction also applies to letting people in your house. People over 70, those over 60 with pre-existing conditions and Indigenous people over 50 should also stay home for their own protection.
You can't just socialise as you used to. That's not allowed anymore. All of us have to adjust.
From midnight, playgrounds and outside gyms will be closed and all training sessions limited to one-on-one with an instructor. Police will be patrolling and non-compliance could lead to an on-the-spot $1,000 fine or even 6 months jail.
I'm pretty done with cautions, to be honest. I mean, the power of discretion is such an important one for police. In fact, it's our strongest power. But I will ask police today to really be out there and enforcing this.
And they have when it comes to restrictions already in place. Just last night, fines were handed out to a restaurant owner and some of his customers for playing a poker game. There are 127 more coronavirus cases in New South Wales, taking the total close to 2,000. The increase in infections is down though.
Whilst it is pleasing we've seen a stabilisation in case numbers, it's important to know that they can vary and jump around day to day based on testing numbers.
Authorities are still looking for a long-term trend before they make any conclusion about these figures and the future. Ashley Raper, ABC News, Sydney.
It's not known exactly how many people in Australia have had the virus or carried it without symptoms. But rapid test kits will soon be available across the country, returning results within minutes.
Testing for COVID-19 could be as simple as this, a prick to the finger. It is a common way of assessing diabetics, and a similar type of test will soon be available to check for coronavirus antibodies, proof someone has had the disease. Australian biotechnology company CellMid expects its first shipment of rapid testing kits from China to arrive next month.
The way it works is that there are two little receptacles here, and you basically put blood in one and you put the reagent that you get with the kit with the other, and you put it down on a table and it develops over a period of anywhere between 3 to 15 minutes.
The University of Technology Sydney is also working on an improved version of the current test. It would ideally give a result in less than an hour and would cost about $10.
What we are trying to shrink all these multi-stage scenarios to a single home-based type test similar to the pregnancy test.
He says the different types of tests won't compete against each other and that testing should eventually be expanded to more Australians.
The more information, as I said, get generated, the more tests get done, the better position we are in for the future development or even recurrence of this disease.
The Deputy Chief Medical Officer, Paul Kelly, says rapid testing is not the gold standard.
In the acute setting where someone is sick with this virus, actually those tests have a very limited capability to test whether people do indeed have the virus or not.
But for those wanting a test, options are on the way. Kathleen Ferguson, ABC News, Sydney.
Everyone will now be able to access a GP and many other kinds of health experts by phone or video. It's called Telehealth, and it's designed to keep patients out of clinics, preserving supplies of protective equipment. Medical reporter Sophie Scott explains.
I've got a bit of a cough, which is a bit concerning for me. But
in a major shake-up to healthcare, patients can now video call or phone their doctors for a consultation.
This will make a huge difference.
You've got all your medications. The virtual visits will be bulk billed, eliminating any out-of-pocket costs.
How popular do you think telehealth will be with Australian patients?
I'm expecting that 80 or 90% of my consultations will be by telehealth.
The move means waiting rooms will be a lot less crowded, which experts hope will slow the spread of the virus.
2.8 million Australians visit their GP every week. We can't have a situation where the majority of the country puts their primary care on hold.
So we're learning, and so are our patients who haven't ever had to do that before.
As well as GPs, patients can have telehealth consultations with psychologists and psychiatrists, nurses and midwives, paediatricians and other experts for kids with developmental delays. Measures are also in place for Aboriginal and Torres Strait Islander health assessments, people with eating disorders and people in aged care. The move away from face-to-face consultations will protect patients and staff. and save precious supplies of masks.
There are obviously cases in various parts of the country where that supply is wafer thin and very much at an extremely short supply level.
If telehealth isn't for you, that's okay. Clinics will still be open for face-to-face consultations for medical problems that can't be treated over the phone.
So it's day 4.
The changes mean those who need to stay home can and still get the medical care they need. Sophie Scott, ABC News.
Donald Trump has extended the US shutdown until the end of next month after health officials warn the pandemic could kill up to 200,000 Americans. New York City remains the epicentre where locked-down residents clapped and cheered healthcare workers. The mayor says they'll run out of hospital supplies in a week without resupply. With the number of cases continuing to rise, the president backed down from earlier suggestions that he'd relax national guidelines in time for Easter.
The better you do, the faster this whole nightmare will end. Therefore, we will be extending our guidelines to April 30th to slow the spread.
America has more than 140,000 infections, the highest in the world. For the first time since the Second World War, Britain is on an emergency footing. Prime Minister Boris Johnson is trying to prevent his country getting as bad as Italy, where 11,000 have died and almost 100,000 are infected. Europe correspondent Samantha Hawley reports.
Italian police salute a convoy of army vehicles transporting bodies. Another day, another 756 people die. The grim toll is now nearing 11,000. In Naples, a priest leads mass from the roof of a church. The neighbourhood congregation gathers on balconies to pray.
In Cristo Gesù nostro Signore, Amen.
Police deploy their eye in the sky to check on people disobeying the lockdown. And on the ground, the police are also deploying water cannons, normally used to disperse protesters, but now to sanitise the streets. 250,000 face masks are flown into Venice, where the health system is collapsing under the strain. So many doctors and nurses have been infected, the government is appealing to healthcare workers to travel to the north and help. More than 50 doctors have died, and at least 4,000 nurses have the virus.
The North is still in a deep crisis. We have a shortage of specialized people in health sector because they have been contaminated.
15% of Spain's medical professionals are ill with COVID-19. The country's just recorded a new daily record of 838 deaths, taking the death toll there to over 6,500. Britain is now on an emergency footing, with special coordination centres being set up across the country and the military being deployed. Boris Johnson has warned things will get worse before they get better, and it could be up to 6 months before things start to return to normal. Samantha Hawley, ABC News, London.
Rugby Australia CEO Raylene Castle will take a 50% pay cut as the code battles to stay afloat. At this morning's AGM, the governing body announced a deficit of more than $9 million. A multi-million-dollar payout to Israel Folau contributed to the sport's dismal financial position. The Rugby Union Players Association says it's been locked out of the process which will decide the future of the game.
I understand from their point of view there's a level of frustration that they haven't had a deep engagement earlier. The reality is I didn't want, and Rugby Australia felt the most important thing was to enter those conversations with a chance to give them accurate information.
Rugby Australia will meet with the Players Association tomorrow to discuss a pay cut for the players. The AFL has secured a line of credit from both the NAB and ANZ banks as it navigates the COVID-19 crisis. The ABC understands it's secured loans of more than $500 million to try to save all 18 clubs from financial ruin. Despite the cash lifeline, AFL boss Skilla McLaughlin warns the code is still facing losses of hundreds of millions of dollars this year. The league suspended its season after round one, and there's no guarantee of when it will resume. A quick look at tomorrow's weather. Brisbane, a possible shower and 31. Sydney, partly cloudy, top of 23. Canberra, early fog and 25. Melbourne, partly cloudy, 22. Hobart, a top of 20 degrees. And that is ABC Late News for now. I'm James McHale. Next up on ABC is The Business.